So I know you've been using lasers for 2 decades now in your practice. What is a laser and how are you using it?
So lasers, it's not a magic toy. Lasers come in different wavelengths, and certain lasers have an affinity for certain types of tissue. So whether that's teeth, whether that's bone, whether that's skin. What I mean by that is that laser is honed to give you a much better procedure with that. So we have things like Waterlase, which is an all tissue laser. It's amazing at cutting skin, cutting bone. And the real benefit of that is because you might think, why not just use a scalpel or a drill? Is because it has light energy. And remember, light energy doesn't only cut, it also heals at the same time. So it's far superior. When we're using our normal instruments cut much more than what we want. But a laser is working at cell level layer, which means that we can do things with much more finesse. What that really means is you get much better healing, you have much more control of the end result that we're trying to achieve. And the way the other wavelengths come into the mix are that certain wavelengths are really good at enhancing healing. So for instance, if we're doing a procedure where we might find that there might be some bruising, there might be some bleeding, we can actually harness that wavelength to accelerate the healing. We can cut out some of the inflammation. So when you have any procedure, whenever you have any trauma, there is a time where you will heal. It's called the inflammatory curve. We can actually take parts of that inflammatory curve out by just using the laser. So it means that you have much less discomfort, much less swelling. You can get on with your life much quicker. And we actually have patients who will tell us that they've had procedures where they've actually had no pain. So I can do implants, I can do surgery, and they find it less invasive than actually if they've had a filling.